Week 11, pronunciation video number 2. EOMI, extraocular movement intact. The eye was saved with the EMOI and fully functioning. CAD, coronary artery disease. CAD was found to be the cause of the patient's heart attack. PND, paroxysmal nocturnal dyspnea. The PND was keeping the woman up most of the night. MRI, magnetic resonance imaging. The patient had an MRI to make sure she was cancer-free. TSH, thyroid stimulating hormone. It is normal for a child to have higher levels of TSH than adults. Bradycardia, resting heart rate under 60 beats per minute. The bradycardia caused the man to be fatigued, dizzy, and weak. Trichomoniasis, a sexually transmitted disease caused by a single-celled protozoan parasite, usually found in the urethra and the vagina of a woman. The trichomoniasis caused a urogenital infection. Pyrogenic, caused by or generating heat, causing fever. The infection was pyrogenic. Syndactylism, which is the fusion of digits. The infant had syndactylism of the toes. Cholangiogram, an X-ray film of the bile duct produced after injection of radioplaque contrast medium. The man was instructed not to eat 12 hours before his cholangiogram. Translumination, a technique of checking for tooth decay by shining the light behind the patient's teeth. After the translumination, the dentist found that my teeth were cavity-free. Mammography, which is a screening tool for early detection of breast cancer. The mammography results came out clear for cancer. Catheterization, a process of inserting a tubular instrument into a body cavity to permit the passage of fluid. The doctor ordered the nurse to do catheterization for his patient. Heterogeneous, not having uniform quality throughout. The child's medication was a heterogeneous mixture and needed to be shaken before it was consumed. Septicemia, a systematic disease caused by the multiplication of microorganisms in the blood. The woman was diagnosed with septicemia. Aberrant, deviating from the usual course as certain ducts, vessels, or nerves. The woman was enraged, which was aberrant from her usual quiet personality. Poliomyelitis, an acute viral disease that is caused by the poliovirus. It is highly contagious and usually affects children. Poliomyelitis rates peaked in the 1940s and 1950s and killed hundreds of thousands of children. Osteoporosis means porous bones. Bone mass and bone strength is decreased. Osteoporosis is a common disease that the elderly suffer from. Hydrocephalus, an abnormal expansion of a cavity within the brain that is caused by an accumulation of cerebral spinal fluid. The child was high risk because he was born with hydrocephalus. Amniocentesis means a procedure used to diagnose fetal defects in the early second trimester using a sample of the amniotic fluid. Because of the age of the soon-to-be new mother, they wanted to do an amniocentesis.